Night sweats, hot flashes, so common. Up to 80% of women can experience some form of hot flashes and or night sweats that can wake you up at night. Hello and welcome everyone. I am Dr. Nicole Smith with Antigravity Wellness, coming to you live from the Antigravity Wellness Telemedicine Clinic, YouTube studio and podcast studio. So I hope you all are having a wonderful week so far. It is Wednesday when I'm coming to you here. If you're watching the recording, welcome. Or if you're listening to the podcast, welcome as well. All right. I wanted to talk to you guys about sleep. That is the theme of this month. And we are launching a brand new program called Better Sleep, Better Life Challenge. Falling into sleep here as we're approaching fall. Sleep is one of the first things that starts to deteriorate in perimenopause. It's one of the first complaints that women have. Their sleep is not as great as it used to be. They have trouble falling asleep, or they wake up in the middle of the night, 2 or 3 a.m. and can't get back to sleep, and their fatigue is increasing. What is going on here? So one of the things that is my goal with this is to give you the education, the information that is pertinent to perimenopausal women, not just like the general out there, oh, this is what all people should be doing. We're still going to cover that because that's very important. And a lot of people don't know basic sleep hygiene routines that are very important. So it's absolutely covered in the course, and we're going to talk about it here as well. And I'm going to continue to do more of these because sleep is so pivotal. It is the keystone to the entire health of your body and your mind and everything. If you're not sleeping, girl, ain't nothing going to work. I can give you all the hormones. I can give you all the things and all the hacks and all the diets, and it's not going to work if you're not sleeping. So it has to be the foundation. It has to be the thing that we're focusing on. We also need to be aware that perfection is never the goal. Perfection doesn't exist. It's not a thing. You're going to have bad nights. You're going to have seasons of life where things are more stressful. This is all about giving you the tools that you need to pull out when things are starting to go awry. All right, so let's talk about what's going on in your body when you're going through menopause and perimenopause. So perimenopause can start. Who knows this? Tell me in the comments when perimenopause can start. For those of you that don't know, it can start as early as your 30s. Women can go through menopause as early as their 40s. The average age of menopause is 52, but within that there is quite a wide range. And then there's those women who have gone through surgical menopause or other causes of menopause that have shut down their ovaries. So that's what menopause is. It's a cessation of hormonal output of the ovaries. The ovaries are like, we're done, we've retired, we've been taken out or radiated, or something's happened where they're no longer giving us the estrogen, progesterone, and the testosterone that they used to. Those hormones have receptors all over the body. They're not just sex hormones. They affect your brain, they affect your heart, they affect your organs, they affect your bones, they affect your muscles. Like everything is affected by these. That is why the list of perimenopause symptoms looks like, Santa's Christmas list, the naughty one. It's a long list. And every woman's symptoms are a little bit different. Heaven forbid you have already an existing condition, an autoimmune condition, inflammatory condition, glucose issue, gut issue, adrenal issue, thyroid issue, anxiety, PTSD, mental health issues that are going on, sleep issues that are already going on, and then you come into menopause, perimenopause. It's going to be worse. Your symptoms are going to get worse. ADHD, your symptoms tend to get worse. Again, it's because those receptors are all over the body and your body is changing now. And we need more sleep and not less. And just at the time when we need it the most is when things start falling apart. So what do? Well, one of the things I look at is, especially in early perimenopause, before we start to have changes in your cycle. So, how I kind of gauge this is based on your age and then based on what your cycles are doing. The more you're having, like, usually at first we have cycles that might get a little bit longer, they might get shorter. But once we start having some missed cycles and then it comes back, skip and comes back, then we're starting to get into like that mid perimenopause range. And when we're going longer periods without a period, so redundant, that is when we're getting closer to actually going through menopause. This transitionary period can last anywhere from a year to 10 years. Like, it's wild. And the more stressors that we have in our bodies going into this, the more exposure to toxins and stress and not enough sleep and already pre-existing conditions that we have coming into this, the earlier we're going to feel it and the worse symptoms can be. So it's worth knowing about it, taking a look at it, and seeing what we can do. Night sweats, hot flashes, so common. Up to 80% of women can experience some form of hot flashes and or night sweats that can wake you up at night. But then we also throw in there more anxiety, more rumination, restless legs, low iron, sleep apnea, which that risk increases over the age of 40. And no, you don't necessarily need to be snoring in order for that to happen. Pain. Oh my gosh. So the musculoskeletal pain that you can have with perimenopause because those estrogen levels are changing, the frozen shoulder that can come on, or just the general joint aches, that can make it hard to sleep. Alcohol. Our tolerance for alcohol is not what it used to be. And while it might help you to fall asleep, it will not help to keep you asleep. And it interferes with your ability to have deep restorative sleep. We just don't tolerate it like we used to. It's best to cut it out entirely or have it well before bed. And then blood sugar fluctuations can also be affecting your ability to stay asleep, especially. So that's something that I've recognized with myself and some of my patients. And sometimes, especially if you're restricting calories too much, over exercising and restricting calories because you're trying to lose weight, and you're waking up in the middle of the night and can't get back to sleep, one of the things that can help is actually to have a small snack. So my go-to, I have that mashed avocado, and I put that on a piece of sourdough toast, and then I'm able to go to sleep when it's like 3 a.m. and I've woken up again and my brain's running and I'm like, I need to go back to bed because I know the next day is really going to be rough if I don't, right? So the first thing we need to do is identify the sleep pattern. You want to ask yourself, is it hard to fall asleep? Are you waking up throughout the night? Are hot flashes or night sweats waking you up? We can fix that. Are you waking at 3 a.m. with a racing mind, can't get back to sleep? Are you hungry? Are you sleeping for 7 or 8 hours, but you still feel exhausted? These are really important things for like your provider to know about, that I will ask my patients about, because that starts to give me clues about why their sleep is interrupted and what is going on with that. So what has the strongest evidence to help with your sleep? CBT-I, cognitive behavioral therapy for insomnia, is the first line treatment for chronic insomnia. So insomnia that is, chronicity is generally anything that's been longer than 3 months in general. So this is more than just think positively or just sleep hygiene tactics, which are great and can be helpful. And if that works for you, then cool, then you don't need this. But there's some people who really suffer from this. And so what it does, it helps to retrain the brain's association between bed and wakefulness. Your bedroom is for sleep and sex only. So many people work, watch TV, do so many other things in their bedroom, and then your brain makes the association, or you've gotten into the habit, and I have women who do this too, and I've done it too, and I've had to retrain myself. When you lay down at night, that's when your brain kicks on with all the stuff, right? All the anxiety, all of the to-do list. All of a sudden, like, you were tired and like maybe you're out watching TV and stuff and you're like, oh yeah, I'm ready for bed, I'm tired. And then the moment you put your head on that pillow, it's just like, bam. Great. So you need to associate it with something else, and that takes some retraining. And that's what CBT-I helps you with. There's some free resources out there. There is like an app that you can download that's free, and then it helps you with that. So something that I did personally, without even knowing about CBT-I, by the way, before I even learned about this, I recognized the fact that I was having that problem. And so what I did was I would have a meditation. I had a meditation app. I've done Calm. I really love Gabby. I'm back on Gabby's app right now. But I'll do a meditation. I will read my book. So that's another thing that I do. And so I have that association. When I lay down in bed before I go to sleep, either I'm passing out because I'm exhausted, or I have that association of like, this is my relaxation time. This is my time to read a book that I really want to read. This is my time to do my meditation and just let it all go. And that takes, some retraining there. But that's part of what will help with that. And that's what CBT-I helps you to do as well. And in addition to a lot of other things, there's a lot of tools in there that really do help. But it's been shown in the research to improve sleep by up to 80% if you stick to it. And it's a tool. Again, it's a tool in the toolbox. So let's say you're doing great and you're doing your thing and your sleep gets better. And then you're like, okay, so I'm in my routine. I'm good. I don't need this anymore. But then something happens. Maybe there's a stressful event. Maybe there's an illness. Maybe there's a time change. God, can we do away with that already? Just to split the difference and leave it alone. Or you travel, like something happens and it throws your circadian rhythm off again. You got to go back to those habits that got you there. And you might need to adjust them too. As we go through perimenopause, holy crap, things are changing, okay? What worked in our 20s doesn't work now, and what works now may not work in, another 3 to 5 years, because your body is changing. And that doesn't mean that anything's wrong with you. It just means that things are changing and we need to adjust our tactics from there and what we do. One of the first things we can do is treat the symptom that is waking you. So if the night sweats are driving the awakenings, sleep hygiene it's not going to be enough. You can turn off the lights and no food before 3 hours before bed, and wear your blue light blockers and do your breathing and do some stretching. If you're having night sweats wake you up though, that's not going to stop the night sweats. Okay. So you might need menopausal hormone therapy. That is the most effective treatment for vasomotor symptoms when it's appropriate. We also have non-hormonal treatment for those women who either don't want hormones, or it's not appropriate for them, or they're not allowed to take it for some reason. We have other options as well. You got to talk with your provider. And if you need a provider, I am a menopause provider here in Washington, Oregon, and Idaho, practicing primarily telemedicine. And that's exactly what we do. One of the many things we do. Non-hormonal prescriptions, like I said, there are certain SSRIs, SNRIs, gabapentin, fezolinetant, and oxybutynin are some of the ones that we can use to help with that. Hormones should not automatically be viewed as a sleeping pill. So this is super interesting. I will often use progesterone because it's one of the first hormones to decline in perimenopause and correlating with our sleep declining. I will often use progesterone to help with a woman's sleep. One of the side effects of progesterone is you feel relaxed and sleepy. It can be great. However, that doesn't mean that we stop with progesterone. Okay, for some women it works great and that's all they really need. We still need to do all of the underlying things though that help with your sleep optimization, with your sleep hygiene, your circadian rhythm. We need to honor that, because if we only throw a hormone at it, it might work for a while or kind of help, but it turns into a Band-Aid, just like any other medication if we're not actually working on the lifestyle, working on the underlying thing that's going on there. So only giving you progesterone and thinking we've just solved all your problems is not always the case. Keep that in mind. So what do we do to help with our circadian rhythm? We need to keep a consistent morning wake time, even after a poor night. That could be really hard. So we don't necessarily want you sleeping in like hours to make up lost time. That being said, if we need to do that every now and again, that's fine, but we don't want to make a habit of that, right? You want to get outdoor light shortly after waking up. Dim light and reduce stimulating content before bed. So don't watch like a scary, intense movie or anything. Exercise regularly, but adjust the timing if late, intense exercise leaves you like wired. So for some people, that actually like energizes them. And so that's not the best thing to do before bed. Of course, though, we still have to take into account your life. So you exercise when it's best for you to exercise and stay consistent with it. But just be aware that if you're, pushing your workout until late in the evening, it might affect your sleep and your ability to fall asleep, especially if you use a pre-workout. Oh my gosh. I know some people are like that, and it's a really bad idea. If we can avoid that after like 2 o'clock, that'd be great. And then the whole trying to catch up by spending more time in bed on the weekends. This can also be a problem. So try to go to bed earlier if you have to wake up really early. But then also on the weekends, we don't want to swing ourselves into the other direction of like, then we stay up really late and wake up late. That will give you what's called social jet lag, and it really messes with your circadian rhythm and messes with your hormones. It messes with your ability to function. It's not a good idea. So try and keep the most consistent sleep wake pattern all week long, whether you're at work or not. Do your best. I know some of my patients, they wake up at like 3:30 in the morning to go to work. Do I expect you to do that on the weekend? Not really, but your body might do it for you anyhow because it's used to it. And it's like, this is what we do. So let's look at what might be masquerading as menopause insomnia. Sleep apnea. Sleep apnea becomes more common as we age, and the changes in estrogen have something to do with it. It changes the soft tissues, it changes the ligaments, tendons, all that stuff. So it can absolutely contribute to worsening sleep apnea or starting down that road. So symptoms are typically snoring, but not always, gasping, morning headaches. Ooh, that's a good one. If you wake up with a headache on the regular in the morning, could be lack of sleep. Maybe you didn't sleep enough, but more likely, especially if it's constant, like you regularly wake up with a headache, my first thought is, ooh, sleep apnea. We need to send her for a sleep study. Dry mouth, especially in the morning, or just unexplained fatigue, and we've ruled out everything else, worked on everything else, and you're still tired no matter how much sleep you get, we need to do a sleep study and figure out what's going on. Restless legs, which is the uncomfortable urge to move the legs, especially at night. So one of the first things we look at is checking your iron and your ferritin. The ferritin is the iron storage, so it will drop before anything else does, well before anemia, years before anemia I've seen. And we'll also have some other symptoms like hair loss and hair that just won't grow. And other things can happen too because of low ferritin, low iron stores. Your menstrual cycles can be heavier and worse, which is interesting because that's probably why it started. But there's a whole thing in the body that it does, and it's kind of messed up, but it happens. And then it's just a downward spiral. So that definitely needs to be evaluated. But also it could be from pain. It could be from muscle discomfort. That is where things like magnesium glycinate is one of my favorite supplements and works for a lot of women to help just kind of calm down those muscle cramps and things like that. It also helps with the brain. So it helps calm the brain too. Again, anything that we talk about here, though, this is not medical advice. You have to talk to your primary care or your menopause provider or somebody else who is caring for you before you start or stop anything, okay? Thyroid dysfunction, because that can absolutely contribute to this, also becomes more common in midlife. Anxiety, depression, trauma, ADHD, or persistent rumination. Oh gosh, that only gets worse at night, right? And then add perimenopause on top of that. It's not helping. So working with a qualified therapist, maybe psychotherapist, in addition to your care team, super, super, super important. Pain, reflux, urinary symptoms, or medication effects. All of these can interfere with your sleep. And alcohol, like I said, can help you fall asleep initially, but will fragment your sleep later in the night and you will not be as rested. So perimenopause may expose or amplify another sleep disorder. It should not prevent us from looking for one, okay? So just because your sleep is worse in perimenopause doesn't mean perimenopause is the only thing that's causing it. We need to look for other things that can be contributing to it. All right, so here are some things that may help and are like the foundation of what we should be doing. So, a cool, dark bedroom with some breathable bedding. Having a cooler bedroom, especially going through perimenopause or menopause, and you're noticing that you're feeling warmer at night, this will really help. So, we're talking like 65 degrees, which for some of you, you're like, oh my gosh, that's cold. And it only has to be your bedroom. It doesn't have to be the entire house. So if you're able to just control the temperature in just your bedroom, and sometimes having it actually, if you're able to time it, it's even better. Because I don't know about you guys, but for me, I am cold at first when I go to bed, like I'm freezing and I want all the blankets, but then an hour or so, everything's thrown off. So having it, the temperature be able to like dip down at night can be very helpful when you're naturally a little bit warmer later on in the evening. Having a calming wind down routine, like I talked about mine. I have my tea. I don't watch anything super stimulating, or try not to. Sometimes we do. I have my book that I'll read when I go to bed, and or my meditation that I do, and that helps me to just like, I'm done. Stretching is really good. Yoga Nidra is a different type of meditation that is meant to kind of get you into those different brain waves that help with relaxation. So even if you are having trouble sleeping, that's a great one to use. It will still help you to like get into those brain waves. Slow breathing can help. Magnesium, like I mentioned. Not a proven cure for chronic insomnia, but has definitely helped with a lot of my patients. Low dose melatonin can be helpful for circadian timing, correcting jet lag, or in selected patients. Some patients are just lower in melatonin. More is not always better. Melatonin is so important though. And that's part of the reason why light is so important, because that will tell your brain if it's daytime or not, and that influences the release of melatonin. We've done studies on like shift workers, night shift workers, and we've seen increase in things like breast cancer in those night shift workers. And one of the things that we think is going on there is because their melatonin is so low. Melatonin is a potent antioxidant, meaning that it goes in there and cleans up things. But when we're not producing it, because we never go to bed on the right time, we're always exposed to that blue light at night, which tells the pineal gland in your brain that it's still daytime. And so it doesn't produce melatonin. That has health consequences. Very, very important. Glycine is one thing that some people can try to see if that helps with their sleep. Up to 3 grams is the dosing on that, but start very low. L-theanine is another one that can be tried. Tart cherry juice has some naturally occurring melatonin in it. Some herbal products, other sleep supplements, they have limited or mixed evidence. So we want to make sure that we're being very conscious about that. And again, what medications are you already on? What supplements are you already taking? What medical conditions do you have? All of these things are important before you start something. So you don't just go out there and be like, oh, this is a sleep aid, I'm just going to try this. I don't recommend that. And supplements can interact with medications and vary considerably in their quality. So especially those combo ones that have like proprietary blends, we have no idea what's in there. And more often than not, even the ones that do list out like exactly how much they have, when I've looked at the research and that particular combo supplement, usually there might be one that's like at actual therapeutic dose, and the rest of the stuff on there is just fluff. It's not at a therapeutic dose. It's probably not doing you any good. Or it could even cause harm if you have a reaction to that. So some things that you can do starting tonight is have a consistent bedtime and wake time, no matter what. Get outside in the morning for your light. Do a little walk outside. Tells your brain it is daytime. Staying inside is not good. And we're still in summer, so that's helpful. When winter comes along, that gets harder. So having like a happy light, one of those full spectrum lights, can be one of those hacks that really helps. And then track what wakes you for 1 week. Is it temperature? Is it thoughts, pain, bathroom trips, noise? or is there no obvious reason, like what's going on with that? That will really help you to kind of pinpoint what's going on there and maybe try and troubleshoot it yourself and or get in with a provider to help work on that issue. Super, super important. So better sleep usually comes from stacking several targeted strategies, not finding one magical product or one magical hormone or anything like that. I wish it was that easy, but it's usually a multi-dimensional thing. It's very complex. So you want to start with the cause or causes, use treatments with the strongest evidence, and personalize from there. If insomnia occurs at least 3 nights a week, has persisted for months, or is affecting daytime functioning, you need to seek clinical evaluation with a provider and consider formal CBT-I, that cognitive behavioral therapy for insomnia treatment. You do not have to accept exhaustion as the price of perimenopause. Your sleep may need a different strategy now, but it absolutely can improve. So if you want to go deeper on this and you want to join us for the Better Sleep, Better Life Challenge, it's running... we're going to get it up and running here really soon. I'm still finalizing a lot of the stuff in there, so it's open now. I'm hoping to have most of it published by the 17th, so you can get started. But you're welcome to join now. There is a 50% off coupon, and that is actually on the booking page. So you'll be able to get that there, and I will put that here in the comments. And that's just running for right now. So if you're watching this later and that deal may not be going on, but it's still a great program. You get lifetime access to it. There's downloads in there. There's trackers. There's more videos from me going over more in-depth information there. So if you've been struggling with your sleep and you're a midlife woman, this would be a great program for you to try. And it's open to anyone, by the way, because it's not medical care. It's just education. So anyone, anywhere can hop in here and do this challenge. You do not have to live in Washington, Oregon, or Idaho at the time of this recording, where we currently practice medicine. All right, guys, I hope you have a wonderful rest of your week, and I will see you on the next live. Bye.